This is the case of Lucy Letby, a NICU nurse in England. She was just sentenced a couple hours ago to life in prison without the possibility of parole for the murder of 7 babies and the attempted murder of 6 more. Let's talk about it. The 33-year-old NICU nurse was found guilty last week. She originally faced 22 charges. She will now become one of only 3 living women in the UK with a life sentence. She has no possibility of parole. This trial started in October of 2022. It lasted 9 months. The jury deliberated for 22 days before coming back with the guilty verdict on Friday. Throughout the entire trial, Lucy has maintained her innocence and denied all of the charges. The cases go back as far as 2015 while Lucy was working at Countess of Chester Hospital in England. She is accused of maliciously murdering and attempting to murder several babies in the NICU over quite a long period of time. Her method, her modus operandi, is air embolus. So she would inject air into IV lines and feeding tubes. She's also accused of, in some cases, smothering an infant, administering insulin, overfeeding purposely, and in one case, thrusting a medical tube or device down an infant's throat. Parents testified against Lucy, saying they would become suspicious because these incidents only seemed to happen when they would finally step away from the bedside. And then she would, phone them or go find them and tell them to urgently return to the unit. And that she was always kind of hanging around when these incidents happened. The babies and the family's anonymity was protected throughout the trial, and the babies were referred to as baby A through Q. She's also accused of, quote, cooking the documentation, so faking the documentation after these incidents. And several doctors also became suspicious of her over a period of time because she was the common denominator that was always present when these things happened. They began to notice similar rashes, purple rashes to the abdomen of some of these patients that are consistent with an air embolus. And then the scrutiny was really heightened after the death of 2 triplets and 1 other baby for 3 consecutive days in the NICU. She was arrested a total of 3 times between 2018 and 2020, but was not charged with anything until 2020. Now, at certain times along this time period, doctors did report her and ask for her to be removed. And the hospital, it would appear, dropped the ball repeatedly with this. At one point, she was removed from bedside and given a clerical position. And then at one point, the hospital actually apologized to her and reinstated her. But over the course of about 3 years, there were several independent reviews and then finally a police investigation. Some coworkers testified during the trial saying that Lucy was very skilled at brainwashing her colleagues and that when there was an increase in the infant mortality rates there, that she would claim it was just a run of bad luck. The reason behind these murders, prosecutors theorize, is because Lucy was trying to gain the attention of a doctor there known as Dr. A during the trial, a married doctor that she says she had a friendship with. And so they hypothesized that she would inflict harm so that this particular doctor would have to respond, and then she would have interactions with him and, kind of like a trauma bonding situation. They did present text messages between the doctor and Lucy. They did go on like little trips to London together and have late night texts. But she says that they were just friends. When police searched her home after she was finally charged, they found a diary and notes that said things like, I am evil, I don't deserve to live, I killed them on purpose because I'm not good enough to care for them. They also found hundreds of handoff sheets. Yet throughout the trial and when she testified, she continued to deny any of these charges, and in fact said that she believes it was a, quote, gang of 4 hospital consultants that were out to get her, to blame her to cover up for their own failures in the care of this infant. And she also would say things like the NICU was filthy, that there was raw sewage there, and that nurses weren't able to properly wash their hands, and that probably led to infection or death of infants. And then she would accuse doctors in different situations of failing to order, say, a blood transfusion in a timely manner, and basically just not providing standards of care. Lucy Letby is now being referred to as one of the worst child serial killers of all time. When you guys have heard me in the past talk about the exceptions to criminal prosecution of nurses being those rare angel of death type situations in which nurses knowingly inflict harm, this is one of those situations. And I just want to remind everyone that these are exceedingly rare. If you would like to learn more about the case or trial of Lucy Letby, there is an excellent podcast on Spotify called The Trial of Lucy Letby with 2 British journalists who were there and chronicled the entire trial.